Hello, hello, hello. Hope you all are having a great day. My name is Cole. I'm one of the co-founders and head of growth here at Move Health. And if you are here, maybe you've brought a cup of coffee like I have, and you are excited to learn about Medicare. That is what we are here to do today, is discuss Medicare, all of its parts and pieces. Yes, this session is being recorded. We will share it with you after the session has concluded. We'll send that out in an email to you. You can use the chat functionality down there in the bottom. Josie, our director of marketing and community, might put a chat in there just to say, hey, how are things going? I'd love to know, where you're joining us from if you want to use that. There's also a Q&A option to be able to ask specific questions. Susan, you said there's a huge echo. Let me see if we can't maybe solve that. Josie, let me know if you are hearing that echo as well. And if so, we can solution around that. Let me know, and we'll get into it. Or if others are hearing it, feel free to fire that my way as well within that chat. But without further ado, we will jump into the conversation around turning 65 and what to know about Medicare. And so excited to share this with you all today, and looking forward to getting started. So without further ado, I'm going to share my screen. We're going to pull it up and we're going to talk about it, because I think everybody's really excited to learn about Medicare on a Tuesday in May. And so we've got beautiful weather, and so hopefully you all have a chance to get outside today. And so I'm going to present my screen here. You should be able to see it loud and clear here. What to know about Medicare, all the important parts and pieces. We're going to cover off on them today. And so if you're here for the underwater basket weaving course, that actually takes place next hour. I have to transition to the wetsuit in the pool for that. But if you're here for the Medicare conversation, you're in the right spot. So moving on, as we get started, a little bit about us at Move Health. So we are a healthcare planning software solution for financial advisors and their clients. And what does that mean? That's the fancy way of saying we help people solve the health insurance and Medicare challenges that they may face, whether this be, early retirement before Medicare. So maybe you're in that camp and you had to figure it out on your own because your advisor, wasn't working with Move Health yet. Well, guess what? Now they are, because you're on this conversation. But we're purpose built for financial advisors and their clients. And we've got lots of expertise in the space. We're well published, within the financial advisory and financial planning world. But at our core, we are interested in making health coverage simple and clear. And what does that mean? Well, it means you know what it's going to cost when you go to the doctor, or you know what it's going to cost when you go to fill your prescription. Ultimately, we want to make this process really, really simple to understand around Medicare, which is what we're going to talk about today, or pre-65 health insurance, whether you're an early retiree or a small business owner, things along those lines. We'll also be able to talk with you and help you with things like dental and vision and all of those. But really, really looking forward to getting started with you all. So there's Dale. You're in Altadena, California. Sorry if I butchered the pronunciation there. Total beginner on Medicare. Vita Padalino, you say, from Birmingham, Alabama. Great. Well, so glad that you all are here. I'd also love to touch on who I am, right? That's an important component. Maybe more importantly than my role as co-founder and head of growth here. My two favorite roles in life are husband and dad. That's our incredible family, my beautiful wife, Megan, our son, our two sons, and we've got another one on the way. We don't know if it's a boy or a girl, but due this fall. And so you can pray for us either way, but especially if it's a third boy. So, all of that to be said, I'm the co-founder and head of growth here. I'm also a musician, and I love working on our old house. And so that's a little bit about me. But around here at Move Health, I'm known as a Medicare expert. And so that's what we're going to talk about. And we're going to take it from the very beginning of Medicare, and we're going to go through some key learnings, right? So key learning number one, we're going to pretend that you don't know anything about Medicare. And so sorry if some of this is redundant, but the reason that we do it this way is to ensure that you have a clear understanding of how Medicare actually works, right? And that you're not receiving the information from your pickleball partner who says, well, I had a bad experience with Medicare because of this, or what have you. We want to make certain that you get the absolute facts from the jump. And so key learning number one, Medicare basics. So there's traditional Medicare, there's Medicare Advantage, and one of these big components and decisions you have to make, there's a fork in the road of what do I select? What direction do I go when I make a transition to Medicare? We'll talk through A, B, and all these things. But the important component is that you understand there is decisions to be made at 65 or when you make that transition to Medicare for the first time. And there's specific timelines and all of these parts and pieces. That's literally why we exist, to help you understand what those are and to make certain that you don't make any of those unforced errors when it comes to Medicare, to use some baseball terminology there. So we're going to talk about understanding Medicare Parts A and B. Medicare Parts A and B are also known as original Medicare. So you might hear me say it as original Medicare or traditional Medicare, but know that Parts A and B is referenced as original Medicare. And there's two components. And a lot of times I hear people get these mixed up and they'll say, hey, it's Part A is medical and Part B is hospital. It's actually the opposite, right? Part A is hospital. It's inpatient hospital, skilled nursing, home health, and hospice if necessary. Part A is usually premium free. How is it free? Well, guess what? When you make a paycheck, you have Medicare withholdings. That's paying for Part A, and that's the hospitalization portion. And so if you are someone who has worked 40 quarters or 10 years, as some people hear 40 quarters, or your spouse has worked 40 quarters or 10 years, you get Medicare Part A premium free. That is the vast majority of people in the United States get Medicare Part A for free. It has a deductible of $1,746 for 2026, and that's per benefit period. And we're going to talk about why that doesn't necessarily, matter when we talk about how we fix that. But important to note that it's there. It will cover home health, hospice, and days 1 through 20 in a skilled nursing facility. One thing, when people hear skilled nursing facility, they might think of a nursing home or things along those lines. That's correct. But what we always say is that Medicare is not a long-term solution for long-term care. And so Medicare Part A, that's the hospital portion. One of our team members references it this way. They say Medicare Part A is the bed that you're laying in, the Jell-O that you are eating, and the nurse that brought it to you. So as you think about your time in the hospital, Medicare Part A is picking up a majority of that. Now, shifting from Medicare Part A as in alpha to B as in Bravo, right? So Medicare Part B is the medical portion. So this is the part that pays for your doctor visits, the surgeon that does a surgery that puts you in the hospital, outpatient services, labs, tests, all of those things fall under Part B of Medicare. And Part B is the portion that you pay for, right? And there's a variety of ways that you can pay for it. But Part B is the portion that you pay for. The standard Part B premium in 2026, and this adjusts every year. I've been in this space for a while. I've only ever seen the Part B premium go down once, and I think that was historic. And so it typically goes up a little bit every single year. And so as an example, in 2025, the standard Part B premium was $185, and it went up to $202.90 in 2026. And so that's the standard. There is a deductible for Part B as well, and that deductible is $283. And one thing that's important to note is that Medicare Part B is going to pick up generally 80% of all of your medical costs. And if you have Medicare Part A and B only, you have a 20% responsibility with no annual cap. And so Part B is the portion that you need to be thinking about as the one that you pay for. And so that's $202.90 as standard. We're going to talk about IRMA here in just a little bit as well. And we'll talk about why that's important to note. And so feel free, again, if there are questions, feel free to put them in the chat or use that Q&A functionality. But again, we're starting from the basics here. So Medicare Parts A and B, this is original Medicare. Part A is free. Most cases, Part B has a standard monthly premium of $202.90 that can get more expensive depending on income from prior years, things along those lines. And generally, these are going to cover just 80% of costs, right? So 20% uncapped. And as someone who just last fall had a full knee reconstruction, not a replacement, my surgeon says I get that in 30 years when the arthritis sets in, but I had a full knee reconstruction last fall, and that surgery between my time in the hospital and the surgeon and all the things that went into it, billed insurance over $100,000, right? So if we think about that example, and if I had in that instance only original Medicare Parts A and B alone, I would have had a $20,000 responsibility, right? I'm not really interested in paying $20,000. So there's ways that you can kind of fix that or fill in those gaps. But that's important to note that parts A and B only, original Medicare only, leaves you with a 20% uncapped exposure point. So that's important to note. I told you that I would touch briefly on Irma. Irma is not your auntie. Irma is not a hurricane. Irma is not your grandma, in this case at least. Irma is the income related monthly adjusted amount. And what this is we call it sometimes the you did well tax. Basically, what that means is that it's an increase to your Medicare Part B and Part D, as in drug premiums. And it's based upon your income from 2 years ago. Who determines this? I wish that I was the person that determined it so I could say no one has to pay IRMA. But in reality, the Social Security Administration is who determines, the IRMA. It can be appealed in particular situations. So if you're someone who is turning 65 and retiring, and maybe you were a high income earner, within the past several years, and you retired and your income goes down into retirement, you can appeal that and actually reduce it. So as an example, I was with an advisor just earlier today where we were talking about a client who in 2024, and that's what IRMA looks at. It looks at your income from 2 years ago. And it says in 2024, this advisor told me my client made $500,000 a year that year, and they were married filing jointly, and so they fell into this bracket, which means they're going to spend for their Part B premium $649.20, and then they're going to have an $83 surcharge that would be added to their Part D premium, and that's because they made $500,000 2 years ago, income, and they were married filing jointly. Now, in 2026, when they retire, their income's actually going to be less than $200,000. And so in that instance, there are 8 viable reasons that you can appeal the income related monthly adjustment amount. And one of those is work stoppage. And so if you have a work stoppage and your income goes down, you can appeal it via IRS form SSA 44, which is the IRMA appeal. And you can have that IRMA either reduced or eliminated. We've seen that be the case in the past. It's something that you file directly with the Social Security Administration, and it can happen. But if you were a high income earner from 2 years ago, important to note that IRMA can be a part of the picture. We cover off on that with all of the clients that we get to work with through an advisor. And so feel free to reach out to your advisor for an introduction to us if we haven't already met with you before. It also has a surcharge that applies to Medicare Part D as well. And so it's a double whammy. And so in some of these instances, you can end up paying at the highest level, you end up paying, almost $800, a month just for this income related monthly adjustment amount via Part B and Part D. So that's IRMA, not your auntie, not a hurricane. It's, the Medicare income related monthly adjustment amount. Now, we talked about original Medicare A and B, and we talked about IRMA, but, we're going to go back to A and B here briefly. And within A and B, it's important to note that it's only going to cover that 20 or that 80%. And there's this 20% gap. And so if you remember that fork in the road that we talked about, how do you choose a coverage option? Well, there's supplements, right? Medigap, those are synonymous. And there's Medicare Advantage plans. And there's nothing that's inherently bad about either of these options. Sometimes you'll hear fear-mongering and all those things around not this, but definitely this, and never this, and sometimes this. That's not the case. There's nothing that's inherently bad about either of these, but they do have unique puts and takes for each of them. So we're going to talk through those, right? So as we go through and we look at supplements within the Medigap side of things, a Medicare supplement or a Medigap plan is going to have a monthly premium associated with it, but it usually doesn't have copays that are associated when you actually go get care. It operates on the open fee-for-service Medicare network. So the easy way to think about it is if the doctor or hospital or facility or specialist takes Medicare, you can go there. You don't need referrals. And again, you're covered anywhere Medicare is accepted. And we'll talk a little more about supplements specifically, but it does require a separate prescription drug policy. So supplements maybe a little bit more on a monthly basis. They have a monthly premium, but they're going to provide the most amount of flexibility. And there's some key reasons why, someone who is turning 65, which is what we're discussing today, might want to go that route first. And we'll talk about those as well. Medicare Advantage, there on the right side of my screen, has low or sometimes no monthly premium at all. But it does have copays that are paid at the time of service, and you might be restricted to a specific network and have only emergency services outside of that. You might need referrals to see a specialist. Some are going to operate on an HMO network or an EPO network or an HMO POS network that require referrals out. And some of them, many of them, will include drug coverage as well as dental and vision benefits. So the easy way to think about this, if you've ever seen a commercial, talking about Medicare on TV, and there's football players and there's, baseball players and all these people talking about, Medicare, they're talking about Medicare Advantage. And why is that? And we'll get into that as well. But you have a fork in the road and you need to select an option for how you supplement or fill that gap. And that's how they got the name Medigap, because it fixes the Medicare gap. So all of that to be said, we're going to talk about Medicare supplements first. They were started in the 60s and 70s. If you remember, Medicare is coming up on its 65th birthday. But it's was started originally. Medicare was started in the 1960s, and Medicare supplements were a quick follow to that. They were unregulated though, so in the 90s they were finally standardized and given plan names and all of these different things. How do traditional Medicare supplements work? This is important to note, that Medicare A and B, original Medicare, remains primary. And so if I can use an insurance term, I'll say primary payer. And what does that mean? That means that Medicare A and B always pay first. So Medicare A and B are your primary insurance, and the Medicare supplement is secondary. And so the way to think about this is, when you go to a doctor's office and you have Medicare and you have original Medicare and a Medicare supplement, you're going to provide the doctor's office with two cards. You're going to give them your red, white, and blue Medicare card, and you're going to give them your Medicare supplement card. The doctor's office can't say, if they see an insurance carrier on your Medicare supplement that maybe they don't accept when it's either traditional health insurance or things along those lines, they can't say, well, we don't take Looney Tunes Insurance Company. You go, well, yes, you do. And they say, no, we don't. And you say, yes, you do. And the reason is, this is secondary to my original Medicare. You can ask them, do you take Medicare? And they say, why, yes, we do. You go, okay, great. Then you take this as well. So Medicare A and B are the primary payer. You choose a private insurance company that provides a Medicare supplement to you. Think of Mutual of Omaha, United Healthcare, Humana, Aetna, Allstate. All of these places will, Aflac, State Farm, they'll all provide Medicare supplements. And there's a couple things that you think about and we think about when we're helping someone to choose one of those. But you choose an insurance company to be secondary to Medicare. So Medicare is primary. You go there, they take Medicare, and then whatever A and B don't pick up, your Medicare supplement then picks up on the backside, right? So you use your Medicare and your Medigap card at the doctor. And again, if your doctor accepts Medicare, you can go there. The two most common Medicare supplements that are currently utilized by folks that are 65 or older in the United States are Plan F and Plan G. Plan F is in Frank, Plan G is in girl. And it's an important note that Plan F is only available to folks that were Medicare eligible prior to January 1st, 2020. So we're seeing less and less of those. That would be someone who worked well past 65, now 6 years past or more. So Plan G is kind of the most comprehensive that you can get. And it's going to cover a variety of different things. But I'm going to go to a chart here, which is hopefully going to help us to, show how this works, right? So if we look at these up here at the top, row 1, this kind of teal blue, supplemental plan benefits. So Medicare supplements have plan types, right? So you'll hear a Plan G or a Plan N or a Plan F. So when you've got all of those, you've got Plan F here, right? This is the one I talked about. You can only get if you were Medicare eligible prior to 1/1/2020. If I go down this, you go green check, green check, green check. Well, what are all these green checks for? Well, it's the Part A coinsurance. It's the Part B coinsurance. It's the first 3 pints of blood. It's Medicare Part A, hospice coinsurance or copayment. It's your skilled nursing facility coinsurance. It's that Medicare Part A deductible that I talked about and your Medicare Part B deductible, right? So then I go down this list and I go, wow, Plan F covers all of that. So if you have a Plan F supplement, you have no out-of-pocket exposure aside from paying your monthly premium when it comes to medical costs. Pretty strong. What's the next best? Well, I can go through this and I can go, the next best is going to be Plan G, right? And so we look at that and we go, okay, great. Let's look at that. Medicare Plan G, Medicare Supplement Plan G is going to be the most comprehensive outside of that. What doesn't it cover? Well, only the Medicare Part B deductible, which is $257 in 2025. In 2026, it's $283. And so, as an example, I talked with someone who said, "Hey, I'm 64. I think I'm going to have my hip replaced. It's elective, but I need to have it done here soon. I think I'm going to have it done, this year." And I said, "Hold on. If you can wait 4 months to have that once you get to Medicare, that surgery goes from, they had a $5,000 deductible. It goes from a $5,000 cost to you to a $257 cost to them, because the Medicare Part B deductible is the only medical portion that person is responsible to if they have original Medicare in a supplement Plan G. So important to note there. Now, a couple other things that are within this that are important. Many Medigap plans available provide different levels of benefit, right? And so I talked about what has 100% coverage, what's not covered. But another important note is that all Medicare supplements are substantially equivalent. So another insurance term there, substantially equivalent based on the plan letter chosen. The easiest way to think about this is that a Plan G is a Plan G is a Plan G. It's going to cover by law the exact same things required by federal law as any other carrier. So you could have a carrier with a Plan G with Aetna or Cigna. They're going to cover the exact same things. Your out-of-pocket exposure is the same. Now, how do you choose a Medicare supplement provider? Well, you do so when you have coverage, and you say, what do we look at? Well, we look at historic rate increases year over year. Which carrier is going to provide the lowest historic rate increases? Which one's going to be the easiest to work with? If we do our job right, you're not going to be interfacing with your Medicare supplement too often. It should be pretty hands-off. And then the last piece of that is how easy are they to get a hold of, right? And how quickly do they pay claims and things along those lines. And so that's the research that we do on your behalf to ensure that you're making an informed decision. Now, all of that to be said, Medicare Supplement Plan G, the most comprehensive. There are other options, but I don't know if I've ever seen someone enrolled into a Medicare Supplement Plan A, because it leaves you with a lot of exposure. But Plan G and other plan letters are substantially equivalent. So hopefully that's helpful. Fire away questions that you might have on that. And how do you compare Medigap plans? Well, you do so, again, looking at those historic numbers and rate increases. Well, someone might say, well, look at this. Here's my premium. This one's $60 less per month. Why wouldn't I go this route? Well, this here is a high deductible Plan G. And what that means is that you've got more out-of-pocket exposure. And so we're typically going to recommend a Plan G Medicare supplement, and these are just examples of what they may look like. But it's important to note your out-of-pocket maximum can change. These are both Plan Gs, which is why they have identical out-of-pocket maximums. This is a high deductible G, which is why it has a significantly higher out-of-pocket maximum. And so important to note that, as well as rating types, things along those lines. And so that's how you compare Medigap plans. We also, again, are talking about historic rate increases and things along those lines to make certain that you're making an informed decision and aren't surprised by rate increases year over year. Because sometimes an insurance carrier will say, hey, we're going to come in at a really attractive rate for a 65-year-old to capture that market share. And then at 66, we're going to raise your rate pretty significantly. And so sometimes you'll see loss leader first year pricing and things like that. And so we help you to kind of cut through that. And, when you look at a Medicare supplement, you might say, if they're all the same, why wouldn't I just go with the least expensive? And that's where you get into some of those rate increases, or you get into some of the service issues, things along those lines. And so important to note that we might not recommend the lowest cost plan option in your area specific to you. We might recommend something that's a little more expensive, but provides more stability. And so though Plan Gs are all created equal, they're not in the sense of who owns them and who administrates them, right? So great, great covering off on Medigap plans there with you. Now, if you remember that fork in the road, we talked about you can go original Medicare with a Medigap plan, which we just talked about in a drug plan, or the right side of that is Medicare Part C, which is a Medicare Advantage plan. Now, Medicare Advantage plans were created in 2006. You might see, again, I talked about, retired NFL quarterbacks talking about Medicare Advantage plans. If you see an advertisement, get an advertisement in the mail, all those things, it is for Medicare Advantage. Why is that? Well, the reason being, if you remember, you have Part A and B. So you still have to pay your Part B premium. And, these usually don't have a premium, or they have a very low premium. But if you remember, when you have a Medicare supplement or a Medigap plan, which we just talked about, original Medicare A and B is primary payer, and your supplement is secondary. With Medicare Advantage, a private insurance carrier, you see my note down here, a private insurance carrier is administrating your Medicare on your behalf. So that now means that an insurance carrier is the primary payer. So that's why they start to introduce cost saving measures for the insurance carrier, things like an HMO network or a PPO network or prior authorization or copays and sharing in the costs or deductibles, things along those lines. So Medicare Part C is going to act a little more like health insurance before you hit Medicare. Though it doesn't have a premium, it does have more costs associated with it than a Medicare supplement plan in most cases. You can't double stack them. You can't say, hey, I'm going to get a Medicare Advantage plan and a supplement. Those don't work together. And typically, a Medicare Advantage plan is going to include drug coverage in most cases. But it is important to note that they do have a network that you must stay within in order to get coverage. And so, example of this, if you're on original Medicare with a Medicare supplement and you live in Indiana, but you want to go to Cancer Centers of America in Arizona, great, you can go. They take Medicare. You don't need a referral. You can go and get treatment there. Now, if you're on a Medicare Advantage plan, that becomes harder, right? You're either going to need prior authorization or they're going to say, we have a cancer center here locally that you can utilize, or you may pay more if you go out of network, right? And that's because a private insurance carrier is now administrating your Medicare A and B on your behalf. And so that's Medicare Advantage. And what I always tell people is and we'll get into this, but you can always go to a Medicare Advantage plan later in life if you'd like to. If your premium on your supplement gets too high, what have you, you can always go to a Medicare Advantage plan. There's no underwriting associated with it, etc. Whereas with a Medicare supplement, there is only a finite period of time in most parts of the country that you can get a Medicare supplement without any underwriting. Okay. And so we'll talk about some of those timelines as well here in just a moment. But Medicare Advantage, let me know if you have any questions about that. Put them in the chat or put them in the Q&A. Looking forward to seeing those. And again, as we talked about, Medicare Advantage, it bundles everything together, right? And so these are examples of Medicare Advantage plans that might be very low cost or very low out-of-pocket maximums. Typically, in most states, we're going to see this number closer to $6,700 or $7,000. This is examples in Florida, though, where you're going to see lower, out-of-pocket maximums with those plans because there's more seniors there. They can spread out the risk. There's more people enrolled, et cetera, et cetera. But they bundle everything together. So this plan's an HMO. It's got a premium of $0, an out-of-pocket maximum of $2,500, et cetera, et cetera. Here are your estimated drug costs. There you go. They bundle everything together. And so you can see that's also where doctors come into play. Are they in network with the plan? Are they out of network? And so it's important to note all of those different parts and pieces if you are considering Medicare Advantage. And so you can see sometimes drugs may not be covered or specific hospitals may be out of network with specific carriers. So it's important to note. Now, we've talked about A and B, what they are. We've talked about Medicare supplements and original Medicare and how they work together. We talked about Medicare Advantage plans, which is known as Part C, but it's not a part of original Medicare. And now we're going to talk about Medicare Part D and how Medicare drug plans work. Now, you have to have drug coverage. You can't go without. You can, but you start accruing penalties. And so we're going to learn about Part D, which is the only one that phonetically makes sense. D for drugs, right? And so we'll talk about this. So here's where we're at in the forks in the road. And here's what drug coverage is. So Part D plans help to cover the cost of prescription drugs. And they are provided by a private insurance carrier. Some of the largest in the country are WellCare, Humana, Cigna, United Healthcare. Those are ones that are going to provide Part D plans. And Part C, Medicare Advantage, they usually include Part D coverage, so you don't need to go buy a standalone. But if you have original Medicare, a supplement, you need to buy a standalone Part D plan to have drug coverage in place. And, Part D plans are going to vary from plan to plan. And you say, well, how do I select a Part D plan if, they vary and I need all these things? Well, it comes down to a fairly black and white decision point, at least for us as someone who's in it all day, every day. It's fairly simple where you can say, my prescription drugs that I take are X, Y, and Z. I go to X and Y pharmacy and I want the plan that covers my drugs at the lowest cost. And so what we're looking at is the plan premium plus your drug costs. We're saying we're combining those numbers and we're saying here's your annual out-of-pocket exposure for drugs. Here's what it looks like for you. And so a lot of times we're saying if your drugs are covered, you can go to your pharmacies that you like, and it's the lowest cost plan. That's the route you go. And you must have Part D coverage to avoid penalties. So what's changed recently? Well, there's now from 2024, they filed some laws that put a cap on out-of-pocket costs for prescription drugs under Part D in 2026. So there's a $2,100 cap for out-of-pocket costs for prescription drugs. So what does that mean? As long as the prescription medications that you take are covered under the specific drug plan that we select alongside of you, you're not going to spend more than $2,100 on medication costs in 2026. Last year it was $2,000. This year it's $2,100, but there's a cap. So as an example, what I always like to joke around and say is that if you have a prescription medication that sounds like it could be a European sports car, prepare to meet your $2,100 cap, right, in out-of-pocket exposure. We will look for the plan that covers it most effectively, but plan to meet that. So, have you heard of the newest Ferrari Eliquis? That's a medication, not a car. But it sounds like it could be a Ferrari, which means it's probably going to be an expensive brand name drug. And so things to note, just we try to make Medicare fun over here where we can. So the important note here is that the cap, the $2,100 cap, does not apply to non-covered drugs. So what are non-covered drugs? Well, simply put, those are medications that are not covered by a specific carrier or specific plan. And so that's why it's important to note, hey, I take a medication. It's important to me that we make certain that your drug plan meets that need specifically and covers those drugs so that that $2,100 cap can play into effect. So here's an example of what that looks like in real life as a part of one of our health plan analyses, right? Here's a WellCare value script. Why would we select this over the other option here? Well, it doesn't have a premium. You don't have an IRMA that applies in this case for this client. It has a $100 deductible, but your estimated drug costs for the year is $20. Why? Because your pharmacy that you like to go to is in-network, preferred in-network. Wow. And your medication is covered, right? And so your Lipitor is covered. So you might have you might fill it every quarter, and you might have a $5 copay when you fill your 90-day supply of that. Whereas with this one, you're going to spend more. Why? Well, because your pharmacy's out of network, and so you're going to spend more on your drugs. And so it's important to note that your pharmacy's in network and that your drugs are covered. Moving on here, a question that we get often. I'm a 65-year-old or turning 65 and I don't take any prescription drugs. Do I need to enroll in a drug plan? The quick answer is yes. If you don't have any meds, just pick the least expensive plan because if you don't and you go without Part D coverage, you risk late enrollment penalties. Or the other component that can happen is that if you don't, take drug coverage and then say mid-year you are, prescribed an expensive medication, say that, a Lamborghini Jardiance, right? And you're prescribed a medication, it's expensive. Well, guess what? You don't have drug coverage, and you can't just enroll into drug coverage when you think you need it. There are specific times of the year in which you can do that. And so similar to you can't wreck your car and then go buy car insurance that'll cover it, you can't do that with your drug coverage either. So there are other creditable sources of drug coverage. These would be like TRICARE, VA coverage, or your spouse's employer plan if they are still working. And if you end up going the Medicare Advantage plan route, ensure that your plan has embedded drug coverage. And so you'll see that there's different where it'll say MA only, Medicare Advantage only, or MAPD, and that's Medicare Advantage prescription drug. And so that's where it aggregates all of those into one thing. So Part D drug coverage. Feel free to answer or ask any questions in the chat if you have them there. So that's Part D drug coverage. Last but not least, we're going to go through some important timelines, right? So important timelines to consider. So we're going to talk about Medicare enrollment periods, key dates and timelines. So you have what's called your initial enrollment period. And so this is your IEP. And it's a 7-month window, right? And what is this 7-month window? Well, it's the point in time where you can pick up Medicare Parts A and B during your initial enrollment period when you turn 65. So it's a 7-month window that is 3 months before your 65th birthday month, your birthday month, and the 3 months after. So Some people don't know that when you turn 65, as an example, if someone was turning 65 today on May the 12th, say their birthday was May the 12th, 1961, we've gotten really good at doing, the current year minus 65 here at Move Health. But say that their birthday was May 12th, 1961. Their Medicare, when would it start? I don't know if anybody knows the answer to that, but I'll answer it here for you. It would start on May the 1st, right? Now, that's because Medicare starts when the first of the month in which you turn 65. There's one caveat to this. If your birthday is on the first of the month, it begins the first of the month prior to your birthday month. So if that person was born on June 1st, 1961, their Medicare would start on May the 1st. And so important to note there. What can you do during this initial enrollment period? Well, you can enroll into Medicare Parts A and B, Original Medicare. You can enroll into a Medicare drug plan. You can pick up a Medicare supplement during this period of time as well. And here's one important note about traditional Medicare supplements. You typically only have a 6-month period from the point in which your Part B starts for you to have a guaranteed issue window to get a Medicare supplement. This is in most cases across the United States. There are some states, a minority, that allow you to do so outside of that window. But the safest way to think about it is Medicare supplements you can only get guaranteed issue for the first 6 months of your Medicare Part B starting. So, why we like to start that conversation 6 months before Medicare begins is because we want to have all those things lined out and then be able to start your Medicare supplement on the day that Part B begins for you as well. And so if you are outside of those 6 months, say that you went 7 months, well, an insurance carrier can now say, hey, we'd love to give you a Medicare supplement, but now you have to pass medical underwriting in order to get it. And so they'll ask you for height and weight and medications and health history and all of those things where you might get denied or rated up. Whereas during that first 6 months of having Part B, if you apply for it, they can't ask any of those questions. They must give you a Medicare supplement with no underwriting. And so guaranteed issue is what they reference that as. So that's the initial enrollment period. We're talked about turning 65, so that's why we covered off on that. Annual enrollment period. This is the time of year that's like tax season for us at Move Health. For Medicare, that runs from October 15th through December 7th. This is the easiest way to think about it. Get it done in November. Get it done in October. Don't wait until December to take care of this. What can you do during this period? You can revise any and all parts of your Medicare. And so always important to review your Medicare drug coverage every year. If you're on an Advantage plan, this is the time of year to switch your Medicare Advantage plan. You could join, switch, or drop a Medicare drug plan during this time. And so that's what you can do during the annual enrollment period. This is when all of the advertisements get really hot and heavy and you see them all over the place. And so easy enough to just say, hey, I work with Move Health through my advisor. I'm going to work with them on this. I can ignore all those mailers and all of those things as well. And sometimes those mailers, let me put a caveat on this or a note on this. Sometimes those mailers are downright scary looking, where they'll send it to you and they'll say, important notice about your Medicare coverage. Your coverage may be at risk. And then it says, always look for the things in the corner that says a non-government resource, or this is not a requirement. Or if you see a little stamp in the top right that says pre-sort standard mail, that typically means it's an advertisement. So if you got nothing else out of this, you've gotten how to sniff out a Medicare, advertisement, because they'll make them look scary. So, but the annual enrollment period, you'll see those things start flying around in the mail. Just keep an eye out for them. And this is the time of year to review anything related to your Medicare. There's also a period of time, January 1st through March 31st, where you can make changes to Medicare Advantage plans again if you needed to. This is also the period of the year where you can add drug coverage if you didn't have it previously. It's also known as the general enrollment period for that. And so what you can't do during January 1st through March 31st, you can't switch from original Medicare supplement to an Advantage plan. You can't join a Medicare drug plan if you're on original Medicare, and you can't switch your drug plan either during that period. It's really specific to Medicare Advantage. Last but not least, bonus learnings and testing knowledge, right? So this is where I'd like you all to, understand what working past 65, because some folks might be on this. They might not be turning 65. Maybe they're working past. So what does that mean? If you continue to work beyond 65 and your job has at least 20 full-time benefits eligible employees and they provide health insurance and creditable drug coverage, you can hold off on enrolling in Medicare, but you need to defer Medicare Part B. Most of the time, folks will pick up Medicare Part A because it's premium free and will supplement, if you have a hospitalization, it'll supplement your current health insurance that you have through your employer, your spouse's employer. But you need to defer Part B and say, I don't want that. And that's important to note. If you're receiving Social Security benefits for 3 or more months prior to your 65th birthday, you're automatically going to be enrolled in Medicare Parts A and B. So again, if you are someone who's drawing Social Security, but you're covered by an employer plan, you'll need to actively defer Part B. There's a whole process where they'll send you the card, the red, white, and blue card in the mail. You sign a thing on the back and send it back and say, I don't want Part B yet. That's rare, but that happens, but it can happen. So you need to defer it actively. If you're working past 65, be sure that you stop HSA, health savings accounts contributions, 6 months before you intend to transition to Medicare. This is only if you're working past 65. If you're transitioning to Medicare at 65, don't worry about this. But if you are working past 65, stop your HSA contributions 6 months before. And the reason being is that Medicare Part A, if you've worked past 65, can and many times does backdate up to 6 months. And so it's important to note that if you're contributing to an HSA, don't over-contribute and make certain you stop those contributions 6 months before you intend to transition to Medicare. Last but not least, if you get nothing else out of this conversation today, COBRA coverage is not considered creditable coverage according to Medicare. So let's say somebody says, I've got a big IRMA to contend with, or I don't want to make the transition to Medicare yet. I'm going to put it off and I'm just going to take COBRA. Well, an important note is if you are Medicare eligible, meaning you're 65 or older, and you've only got COBRA as your coverage, COBRA is federally required to only cover the portion that original Medicare would not. So as you think about this, here's where the note comes in. It's like reverse original Medicare. COBRA, if you only have COBRA and you're eligible for Medicare, COBRA is only required to cover 20% of your medical costs, as opposed to original Medicare picking up the 80%. COBRA, because you're Medicare eligible and don't have it yet, doesn't matter if you have it or not, is not going to cover all of your costs. They're only required by federal law to cover the 20% that Medicare wouldn't. And the other piece is it's not considered creditable coverage according to Medicare. So you start incurring Part B and Part D late enrollment penalties as well. So don't take COBRA if you're Medicare eligible, please, if you get nothing else. So that's working past 65. So we talked about here what's not pictured in the difference between these. If you want to jump into the chat and share them, I will answer it if no one does. What's the difference? Here's traditional Medicare with a supplement and a drug plan. Here's Medicare Advantage. They have almost identical annual financial risks. Now, what are the differences? Not sure if anybody's going to pick out the differences because we don't display them here. But one of the big differences is network flexibility. With traditional Medicare, I can go anywhere, right? That takes Medicare, I can go. Do you take Medicare? You do? Great. Here's my Medicare supplement card and my original Medicare red, white, and blue card. Whereas with a Medicare Advantage plan, I might say, hey, do you take this carrier? And they go, no. You go, oh, bummer. I guess I can't go to that specialist. So that's a big difference. Though they have identical annual financial risk numbers, there's a big difference in terms of flexibility. Total monthly premiums on traditional Medicare, a little bit more. You're going to spend $232 more per month than you would on a Medicare Advantage plan, but your out-of-pocket risk is much lower. So we'll always look at this annual worst-case scenario financial risk number to understand what's going to be the best option. And always, as you remember, you can always go from traditional Medicare to a Medicare Advantage plan. As we talked about with that 6-month window of guaranteed issue for traditional Medicare and a supplement, you can't always go from Medicare Advantage to a Medicare supplement. So those are important things to note there. What to check when you're enrolling in Medicare: provider networks if you're exploring Medicare Advantage, drug formulary, drug costs, rate increases if you're exploring Medicare supplements or Medigap. We do all of that research with you. Carrier stability. We'll verify your IRMA rates and we'll help with out-of-pocket exposure as well. If there's anything else that I missed there, I'd love to know what you believe needs to be checked on when enrolling in Medicare. Feel free to use that chat or the Q&A functionality as well. What's your next step? Say I'm someone who's turning 65 soon. I'm coming up on Medicare. I've got questions, things along those lines. What is your next step? Well, that's a great question. The easy way to think about it is ask your financial advisor or reach out to us. We would love to connect with you and help you to understand what your next steps are and help to make it easy. And so we do what's called a health plan analysis. And some of these screen grabs that you saw from this presentation are from our health plan analysis process. And so we're going to provide an overview of your coverage, whether that's, provider networks or HSA eligibility, right? That's kind of thinking about pre-65 or drug coverage. We'll look at carrier stability and drug costs, et cetera. And we'll do the same work in the pre-65 space. So often we see someone who turns 65 and maybe their spouse is a couple years younger. Not everybody is born on the same day as their spouse. There are some, but that's the vast minority. And so make certain that you know that we can do both of those. And so reach out to your advisor if you would like a review, or reach out to us and we're happy to help. And so we're going to review all those things, provide you with a health plan analysis that's going to spell out in really clear English alongside a member of our team who's going to kind of Sherpa you through this process of making the transition to Medicare, whether that's at 65, after 65, or we need to figure out pre-65 and the transition to Medicare. We can do all of those things alongside of you. And so without further ado, we've completed our session today. And we hopefully, if there are any questions, happy to help out with those. Vita, great question. A question from Birmingham, Alabama. Vita says, do you have to re-enroll every year? Great question, Vita. And I answer that in a couple of different ways. That annual enrollment period, October 15th through December 7th, is the time to review your Medicare coverage in all its capacities. Now, one thing that we say if you've taken original Medicare, a Medicare supplement, and a drug plan is that you need to marry your Medicare supplement and date your prescription drug plan. So what does that look like in practice? Well, your Medicare supplement, usually when we're helping someone into it, we're telling them your Medicare supplement is going to be your partner for life and health insurance coverage. You're going to be with them throughout the remainder of our time here on earth, right? That said, your drug plan can change every single year. Your medication might change. The formularies for that specific drug plan might change. So it's important to review your drug coverage every year. Same thing for Medicare Advantage plans. Those can change year to year. Networks can change, things along those lines. And so Vita, hopefully I answered your question there. We can certainly help with that. You should review your coverage every single year. Sometimes we look at drug coverage and we say, you're great right where you're at. Don't make any changes. It'll renew into the new year. Same for Medicare Advantage. But very rarely every year are we reviewing Medicare supplements. Those are typically kind of set it and forget it. But drug plans and Advantage plans, we're going to re-enroll and review every single year. That's a great question. Any other questions that are out there? Dale, thank you. Complicated subject. I would love to have you on a couple others, Dale. Feel free to join those. And we're happy to answer any questions. And again, you can always reach out to us, with any questions of, if you think of something, if you're like me, we're going to hang up and you're going to think of a question, reach out to us. We're happy to help. And, again, Medicare can seem scary. Health insurance can seem scary. But a lot of times it's just taking the flashlight, turning it on, and shining it into the closet and showing there's no boogeyman in there. There's nothing scary that's there. It's truly just health insurance and Medicare. You just need to mind your P's and Q's and cross your T's and dot your I's and whatever else you want to say there to make certain that you're covering off on everything that's important. And that's what we're here to help with. And so, Dale, we'd love to have you on another one. Thanks for the great questions, everybody. Really glad that we got together. And feel free, again, reach out to us with any questions. Go to your advisor if you have any, you'd like to go through the health plan analysis process with us. But we'll talk soon. Have a great day. Thanks for joining us.